Well, good morning.
Good morning.
Boy, that's nice. That's like church. My name is Eric Harmon, and I am publisher and president of Cincy magazine. It's my pleasure to kick things off. You know, my wife had told me that I have some nuances, and one of them is that she had said that anytime that we travel, Eric, and say we're at the airport and we're in for a long ride, you know, so you never pass up the opportunity to use a restroom. Why do you do that? And so we walk by in the airport, I'll say, oh, excuse me for a second. And so I tell her, well, you know, you never know if we're going to get stuck or we're going to get bumped or we're going to have to sit in the middle of the airplane and you won't be able to get out. And I sort of equate it to a breakfast meeting like this. I hear a lot of people eating, which is good, because that's what interests me, is to see, well, who does get to go and grab food? I've been told a second of my nuances is that if there is food within probably a 40 to 50 yard radius, I make a beeline for that food at any kind of function. So I've been told that I've never passed up an opportunity like that. Unfortunately, good food does carry a price, right? We all know that. This is why we have strict orders here for the Savannah Center that we're to give you some good food, but not too good food, if you know what I mean. Okay? Well, all doctors are known for giving us good advice like this. Marching orders, per se, maybe telling us that we got to watch what we eat. We at the magazine like to listen to our readers like you would a doctor. And one of the things that they've been telling us over the last year or so is that they're very interested to learn more about what's happening in healthcare, and specifically about what's happening here locally. Our conversations today will focus on the future. And to do that, we knew that we needed to gather some top-level panelists, as you see here today. All of them are experts in their fields. And we're here today to glean a little bit from this conversation. And what we'd like to do is help you drive your marching orders for yourself as an individual, for your company, and I think as important for our region. Now, we do have a lot of things to cover this morning, and this is why I would, if you'd like to go get some coffee, and if you have not gotten breakfast, please do. But first, I would like to make a quick couple of introductions. I would like to thank our sponsors. They have given us a tremendous amount of input, with this being a first-year event that we look to have repeated year after year. And with that, I would like to thank Humana as our presenting sponsor. Tim Capel is here this morning. Tim, thank you. Tim is president of Humana, Ohio. I'd also like to thank CBTS. Another one of our sponsors is the Highland Group. Thank you. And we also have as our last sponsor ITA Audio Visual Solutions. Let's give them all a round of applause. We have a committee for this event. I'd like to introduce them now. Greg Osmond is with Mercy Hospital Fairfield. Mark Rensky is with the Highland Group. Greg Ebel is with the Health Improvement Collaborative of Greater Cincinnati. Harry Snyder is with the Great Oaks Career Campuses. Kim Curtis and Dr. Derek Van Amerongen are both with Humana of Ohio. Dara Miller is with Hospice of Bluegrass. Yvonne Jackson, Dan O'Brien, and Jolene West, all of CBTS. Let's give them a round of applause. And last but definitely not least, I would like to thank our partner in this event with the Westchester Liberty Chamber Alliance. All of you that might live or work here in Butler County know what a strong influence this chamber has locally. And it's been a pleasure as we've developed with the magazine a relationship with the Westchester Liberty Chamber. And working on this event, they had some great ideas. The neat thing about the Westchester Liberty Chamber Alliance that I've seen through the years is that they are a leader for your business and driving things that they know you need, not only here locally, but throughout the region. And we talked about ideas, and so just a couple weeks ago we were kicking around some ideas about nicknames. And so, Joe, I am going to talk about this. You know, in Cincinnati we have Pill Hill, right? And there's other nicknames, you know, the folks out there in the West Coast, all the Apple guys and girls, the Silicon Valley, right? Well, for this area, off of I-75, this burgeoning area of healthcare, we have deemed this the Health Highway. What do you think? Oh, okay, well, if it sticks, you know where you heard it first, okay? At this time, it's a pleasure to introduce Joe Henson, who is the president of the Westchester Liberty Chamber Alliance. Joe.
Thank you, Eric, and good morning, everybody, and welcome to Westchester and our first annual Healthcare Forum. The Westchester Liberty Chamber Alliance is proud to be a partner with Cincy magazine on this special event. In planning this program, we focused on really three main areas that I think you're going to see today. One would be what's going on with healthcare today. I think a lot of you wondering what's happening today in healthcare. Number two, which we're going to be talking a little bit about here, is the development of healthcare along the I-75 growth corridor. And I think that's something you need to keep in mind as you hear the discussions this morning. And third, as Eric mentioned, something that we feel will set this event apart each year that we do this is what do we see in the future of healthcare. As you know, healthcare has taken the lead in new industry growth along the I-75 corridor, starting in Westchester and Liberty Townships. The future of healthcare is tied locally to our changing demographics. And if we could, if we could put the map up, I'd like to give you an idea of what we're talking about here. And we've got, as you look at this map on the screen, you've got three circles. You've got the blue circle, which is in the middle, which is the Westchester Liberty Township area, where you have 100,000 people. The green circle, the next circle out, is 275 up to 675 along I-75, where you have 1 million people. The third circle is what we look at as our region, which is 275 northern Kentucky going north up to I-70 past Dayton, where you have 3 million people. What has happened here is the blue circle was an area that was underdeveloped as far as healthcare support, with all the people in the growth area, if you will. And healthcare has basically, in the past 11, 12 years, has taken this area by storm. We started off, we saw UC Physicians, Westchester Hospital as we go up the corridor, Children's Hospital Medical Center in Liberty, Mercy Hospital Fairfield, Tri-Health has 15 acres for development. Middletown Regional Hospital changed its name and moved over to the east of 75, Atrium Medical Center. And now, this past June, we saw a new interchange open up right before 675 called Austin Boulevard, which now is developing and is going to have also a healthcare flavor. But it hasn't stopped there. What we have seen is also education that has come into play, which is probably the second biggest industry change that we've seen in our area. And healthcare, or the difference now in education is before you would go to where their campus was. Now they're coming to where business is and where the focus is. Well, education is not only coming here, but education now, too, has a healthcare tilt. Because what they're finding is there is a need to be a farm system, if you will, for the future growth and development of this corridor for healthcare. So a lot of the curriculum that we see for these educational institutions is focused now on healthcare. The opportunities for continued growth in healthcare, as you can see, are tremendous. This annual forum will help you see where we're at today and where we're going in the future. As Eric mentioned before, we cannot do this event by ourselves. We need sponsors to help us support this. One of our sponsors today is the Highland Group. And here to introduce our moderator for this morning's program, please welcome Highland's President, Todd Heldon.
Thank you and good morning. On behalf of the 800 insurance professionals at Highland, I'd like to thank you for coming to the inaugural Healthcare Summit. As a leader in the field of insurance and risk management for the healthcare industry and an employee benefits consultant for over 1,000 companies in the Midwest, we recognize the need to provide a forum such as this to discuss the future of healthcare for the Tri-State. We hope you'll enjoy hearing from local experts and national expertise as well in this field, and information today hopefully will help drive bottom-line results for your company. It's now my pleasure to introduce the moderator for today's discussion. Dr. Derek Van Amerongen, I got that right, serves as the Vice President and Chief Medical Officer for Humana Health Plans in Ohio. In this role, he oversees the medical management and strategy for one of the nation's most innovative health plans. Before joining Humana, Dr. Amerongen was National Medical Director for Anthem Blue Cross and Blue Shield, working with Anthem's national accounts and also creating and directing the company's Women's Health Initiative. His experience also includes over 6 years as Chief of Obstetrics and Gynecology for the Johns Hopkins Medical Services Corporation in Baltimore, and as a faculty member in the Department of Gynecology and Obstetrics of the Johns Hopkins School of Medicine. Dr. Van Amerongen has written and presented extensively on managed care and other health topics. He's on the faculty at Xavier in the School of Health Administration. He has been awarded commendations for his teaching contributions at both the Johns Hopkins School and the University of Cincinnati School of Medicine, where he's also an associate professor in the Department of Obstetrics and Gynecology. So at this time, please welcome me, or join me in welcoming Dr. Amerongen.
Thank you. We have a great panel today that is, I think, going to help us understand a little bit of the issues that we're talking about when we talk about healthcare, and I'd like to introduce them now. Tom Finn joined P&G in 1984 as a brand manager, and since 2007 has been the president of global healthcare for Procter & Gamble. Dr. Bob Graham is a professor of family medicine at the Department of Family Medicine at the University of Cincinnati, and has also served as executive vice president for the American Academy of Family Medicine and a former rear admiral in the Public Health Service, and I'm disappointed you didn't wear your uniform today, Bob. Maria Ortega is the managing director for the Cincinnati business unit of Quest Diagnostics, which is an international healthcare organization providing diagnostic insights to physicians. Previously, Maria was business director for Quest in Puerto Rico and has also been trained in Six Sigma processes. And Tom Urban has been in our community since 1993 with Mercy Health Partners. He's been president of Mercy Fairfield since March 2008, and prior to that was CEO of the Southwest Ohio region for Catholic Health Partners. I'd like to start with you, Tom Finn. You are president of Global Health Services for P&G, but you have been devoting hundreds, if not thousands, of hours over the last several years working with the Aligning Forces for Quality project, sponsored by the Robert Wood Johnson Foundation, focused on improving healthcare in our community. A key part of that is public reporting of outcomes.